I just don't think we're going to have a lot of people that don't have that much money will have access to these type of treatments if they do get, those type of.
It seems like that's like the trend of half the topics is that if all of the medical in the U.S. it tends to be like only accessible to people who have, higher tier healthcare or
financially are able to do it, or they just know the right people. People in high places.
What's your suggestion outside of the basic stuff? Like, yeah, we can work out, eat healthy, but what is your suggestion for people who are looking as a medical professional? If somebody would ask you like, hey, where do I get like top tier healthcare? How do I get it for a price that, I can afford? Or if they're asking about certain things, like maybe you bring up experimental treatments, but they don't know where they can get it, how they can get it. What are ways that they can possibly like manage or get into that? Is there pay as you go? Is there like plan or options? You as a provider, do you have like connections? What's the...
there's all different types of third-party financing companies, and depending on your credit, depending on all the things behind that. If you own a business, if you own your home, or you have a lot of equity in your home, or just different assets that you may have, there's you can always find a financing company that will do that for you. You can get a personal loan. There's a lot of things you can do, and some people have already have gotten second and third mortgages on their homes because they've had a lot of equity in it. If they were to get certain types of cancers or certain illnesses to help pay for that. So can you do it? Yeah. Should you have to do that? There should be access everywhere, but there's a happy medium. That's where the, socialized medicine type of issue comes up. And that's a whole other podcast, and it's, and I have my ideas on it because I'm a doctor. Do I need to not get paid a certain amount of money just because of all my training and schooling? In other countries, their country pays for they don't have loans like we do in America. They don't have school loans. And so, yeah, they make less than we do, but they don't have any school loans. We do. We have a lot of school loans. And in fact, if you're going to a professional school like law school or, medicine.
You're paying like what, $2,000-$3,000 a month on some of those loans.
Oh, yeah. Yeah, absolutely. Or you're just paying forever. You're literally paying forever. If you work really hard, and you bust your ass and make a lot of money in a short amount of time, then you can pay, $20,000, $50,000, $100,000, whatever, in a year. So you can make that amount lower and lower, and it will, hopefully you only pay for 10 or 15 years rather than 30 or 40 years. But if somebody was saying, how can I do that? There are other options. I mean, if you really don't have money, you can be a part of the Medicaid and Medicare type of insurances, but it's just
that's also changing all the time.
That's changing all the time. And
do you know anything about the new bill? Like I saw there was something about Medicaid getting affected by Trump's.
That particular bill, it's taking some funding away, some federal funding to particular states for things like that. And so, yeah, it's going to be affected. They're going to, which I can't argue that it's so wrong. Like every bit of it is wrong. Because, I don't want them to take away insurance for people that need it, But parts of the bill also state that you need to either volunteer or work 20 to 30 hours a week. You need to do certain things to maintain your ability to have that type of insurance. If it's a federally subsidized insurance, which most of them are in some form. So I can't argue that because I don't want people not working and living off the government. Maybe some people in the government want that, so they can control them. I don't agree with that at all. And I think people should work if they can. Now, granted, people are disabled and people can't work, and I get that. But there are a lot of people out there that aren't that sick, that aren't that disabled, that could, but they're still living off the system. And that is what hurts everybody that is working. I'm going to give you an example that broke my heart when I was doing a lot of anesthesia it was probably 2 or 3 years out. I was working at Maryville. Maryville Hospital is not here anymore. And it was like 3:00 in the morning doing OB. Okay. And so I was putting in epidurals in women that are laboring. And so I went into this first room, and it was this girl, second baby. She was young. She was probably in mid-20s, somewhere around there. And she was a manager at like a 7-Eleven or one of those convenience stores. And she was so immediately when I went over there, and this is the last thing somebody needs to be worried about when they're, in labor. How much is it going to cost? She had insurance, but it was, I think, like our Medicaid is called access. So she had access. It was a higher tier access, but it was access. And she was worried that, it wasn't access. It was an HMO. Sorry about that. And but it's still subsidized. And there's a lot of limitations to certain HMOs. And apparently she got it through her work and whatever. Anyway, so she was worried about how much is that epidural going to cost? And if she has to go to a C-section, what is that going to cost? And, some of those, I can't, 3:00 in the morning, I'm not the person to be talking to them about. I'm just there to help them, to make them feel comfortable as best I can. And she was worried. She was like, well, if I can't pay for this, it's going to affect my credit, although I'll have a job, but then I won't be able to, get an apartment or maintain my apartment or get a car or, whatever. Whereas, so she's very stressed about it. Whereas I went across the hall and there was a patient that didn't speak English, did not have a social security number. And by law, we have to provide any, I guess, urgent or emergent treatment to these patients that come in, and they get what's called emergency access or emergency Medicaid. And so with that, I had to do an epidural that access pays me or pays my anesthesia group a certain amount of money to put an epidural in for that patient. As well as if she goes to a C-section, they pay me as well, or the anesthesia behind that, but also pays the OB-GYN doctor as well. And she has no repercussions from that. If she can't pay it, it doesn't matter. She doesn't speak English. She's somebody that's not an American that just came in. We provide that for her. So my quandary, and I'm Mexican American, and I want my people, if you can say that. My people are American because I was born and raised in Texas. Now we consider that a country, but that's neither here nor there. It made me think a lot, because this poor white girl that has a job and has insurance, but is afraid that she's not going to be able to pay, because they only pay for a percentage of her bill. And then she'll still owe $2,000, $3,000, $4,000, whatever the bill is. She can't pay that. And her credit's going to be affected. And now she's going to have trouble providing for her kids. Whereas the person that's an illegal alien is coming in and they're not going to have a bill, because our state, as well as our federal government at that time, this is 20 years ago, they had something in place for that. So it's a quandary as a medical professional of me thinking, why does this American, with a social security number, why is she going to not be able to provide for her family? And she's from here. And she's doing everything she needs to do. She's got a job. She's got insurance. Yet she's going to be affected that way. And the person that doesn't have any of those things, including a social security number, is not going to be affected. So it's hard for me to say, well, what's right?